My name is Joe Page. I am a public health major with an option in health management and policy, and I'm also majoring in Spanish. I was always interested in law and government, and originally, like when I was a kid in middle school and high school, if you asked me what I was going to study, I said I was going to go to school for poli-sci and ended up going to law school. Then I realized that health policy was a field that existed and that I could kind of combine those passions together. And so I was looking for places that had programs with like a health admin, health policy, something like that. And then I realized OSU had an option in their public health major. So I was super excited to get to come here and do that. I think that my degrees have had more overlap than I thought that they were going to. And I'm really, really glad that I chose to do the Spanish degree now that I'm just about done with it and have gained a lot more understanding about some cultural and social impacts and issues related to Spanish and Spanish-speaking peoples. And then in the public health space, OSU has been hugely instrumental in what I'm about to do in the next few years. I think I've made some really awesome connections with some faculty. I'm excited to kind of see just how all those connections and relationships intersect, and I think that is indicative of kind of what the future is going to hold for me, right? I'll be able to carry these lifelong, and then probably in 20, 30 years when I have a career, I'll hear about some other amazing work that they're doing, and I'll be suggesting to people that they go study at Oregon State or talk to some folks at Oregon State. It's been really awesome to just kind of combine those passions together to just kind of see how just prevalent public health is. I mean, public health is everything, and so that's something that we're just really interesting to kind of learn about, and then to see one of the primary ways that we create healthy communities is through policy and advocacy and things like that. So very exciting to kind of combine those passions. At first I was like a little less than enthused that it was a public health degree. I had never really cared that much about public health as how I understood it before. And so I definitely think, my mind has been completely changed on that. I think that that's largely due to the fact that I went to a school that has a lot of really awesome, really smart faculty who do a lot of good work for people in the state and nationwide. And I think especially coming here, my whole sophomore year was remote. It was the COVID year. So I think having exposure to such like dedicated and really like respected professionals in public health at such a top tier public health school like OSU has was really, really beneficial. And I didn't realize that maybe going into it, but now that I'm about to graduate, I'm super, super grateful that I went here and had that available to me.